are patients that you do find yourself thinking about before you go to sleep and first thing in the morning.
My son said to me the day before, he said, "You're having a stroke, Dad." I went, "I can't be having a stroke. I can talk, I've got my strength."
It's not the same for everyone.
Smoking cessation does take up quite a bit of our time, probably about a third when you consider all things across the population.
Yesterday was bad. And today it's getting worse.
Not a smoker?
Oh, I am.
You're joking?
One of the reasons why this job is rewarding is because it's in those more complex patients, the ones whose needs are greatest, where you can get the most reward back. I mean, like his heart, basically.
I had looked at it in his heart respect, and I thought to myself, how much longer have I got with him?
I just thought it might have been where obviously he might have been a bit fat. Yeah.
Hello, Fanamo Surgery. How can I help?
Susanna Blake? Just take a seat. How can I help?
Keep on feeling a pain in my back passage.
Really? For how long has this been happening?
Well, I have it for a long while because I have an operation about a couple of years now in there.
Yeah.
But since I have the operation, it's not right.
Okay. Have a
A
look.
couple of days ago, I went to the toilet, and after I finished, I passed a little bit of blood.
Okay. How long ago did you have your operation there?
When I had the appendix out, a couple of years ago, must about 3 to 4 years.
And is the pain on the outside or the inside?
I don't know what to say, but it feels like it's swollen inside.
So we just need to examine your back passage. Is that okay?
Sorry?
We need to examine your bottom to see what we can see, to find out the cause of this soreness. Is
I
that
had
okay?
2 examinations,
When was that?
what was 4 to 5 years ago?
Oh, no. I mean, we need to do it today.
Today?
Yeah, Well, we need to do it at some stage. It doesn't have to be today, but we would need to examine your back passage to see what is causing your pain.
Yes.
So we can do it now, or we can do it again later. I can give you some cream if you want to try that first.
Well, give me the cream and try that first.
Okay, yeah. As GPs, we perform intimate examinations every day. It's the norm for us. It's business as usual. So patients should understand that we're well used to that and we're not put off in any way, and they shouldn't be put off either. The less embarrassed you are, the better for your health, I think. I want you to use the ointment every night and every morning.
Yes.
And then I want you to put in a suppository inside in the back passage twice a day. You just have to push them up into the back passage and they'll act to reduce any inflammation that's there and act as an anaesthetic.
Yes.
So these 2 things might sort it out.
Yes.
But if they don't, come back.
Yes, all right.
So you just have to go and pick up the prescription, the pharmacy here.
All right, thank you very much.
You're welcome. All the best, Susanna.
Thank you.
Bye.
Anthony, do you want to come down? Come on in and have a seat. How are you?
Not very well, apparently.
No. So what happened?
Can I tell you how it happened?
Yeah, of course you can.
I had took the kids down the park on the Sunday, had a little tingle in my head.
This is the grandchildren, yeah?
Grandchildren, yeah. Anyway, woke up Friday morning, it hadn't gone. So the old lady's going, go to the doctors, go to the doctors. So
She's right.
I jumped in the car and drove to the doctors.
And it all took off from there?
It all took, because I walked in and I said, my lot think I'm having a stroke, but I can't. My son said to me the day before, he said, "You're having a stroke, Dad." I went, "I can't be having a stroke. I can talk, I've got my strength." It feels tingly.
The symptoms you get with the stroke depend on where the blood supply is being messed up in the brain, and it's not the same for everyone. Okay. And so some people will get abnormal symptoms, some people will get bang, all of those ones on the advert, and that's then very easy to diagnose. But you did the right thing, it didn't go away. You listened to them and you came down.
A gentleman came in this morning to get an appointment with the doctor because he was feeling unwell and thought he was having a stroke. So we got him in to see the doctor. and she thinks he needs to go straight to hospital, which is why she's called you.
Yeah, I'm not like the advert, am I? I'm not slurring my speech, I'm not feeling weak.
Just numb all down the left side.
It feels like I've been to the dentist, it feels like I've been injected,
Yeah.
And that feels like I've slept on it all night.
You're not in any pain.
No, I just feel like it's a needle.
They saw you and they scanned you.
They did a CT scan.
And then you had
Nothing.
an MRI scan
and
as
then I
a...
had an MRI the next day.
That showed the stroke, yeah?
Up there a little bit.
Okay.
Yeah. And does this get any better?
Yeah. One, the damage does tend to get a little bit better.
Right.
And two, your brain is very clever. So what happens is that the bits of the brain that did some of those fine movements that maybe aren't up to doing it, well, then other bits of the brain take over. Yeah, it's sort of like collateral. Okay, and they wanted me today to check your blood pressure, yeah, because they were concerned about that. Right. Oh, no, it's been high. Are you taking your tablets?
I'm taking all these tablets they're giving me.
All of them, yeah?
All of them. But if you look at this, that's what it was yesterday morning. So it was 200, and then this morning, only again before I took them, 224 over 103. An hour afterwards, 166.
So it's not controlled?
No, it's not. If I'm waking up this morning, it's sky high, and they like run out. Should I maybe take one at night or something?
Yeah, so there's no point in the pills reaching their use-by date at 1 o'clock in the morning when actually you're not doing anything. Your blood pressure is likely to be lower than it is during the day, than it running out at 1 o'clock in the afternoon when your blood pressure is going to be up, you're going to be moving around. That's when you're more at risk. So, looking at all this little lot, Perindopril, these ones here, they are the maximum dose of those, and they're good for your heart. You're just stuck on them, OK?
Yeah.
This is a clotting one. The amlodipine, you're on the maximum dose, so can't increase those. It's the bisoprolol that we need to increase.
There's nothing else you can give me.
The logic is, Anthony, to get you to the maximum dose of all of those before we say, right, now we need another one, yeah? I want you to carry on the 5 milligrams of bisoprolol, but I'm adding a 2.5.
OK, and just take it in the morning.
Taking it in the morning.
Can I ask another question, which is probably a bit cheeky?
Go on, you can try.
Every time I've been 4 times, I think, or 3 times since I got back out of the hospital last week. I keep seeing different doctors and have to explain them each time what's going on. Would it be better to see one doctor?
Yeah, and if you can find out a way that we can manage that, we'd be really, really grateful. We have so few doctors for the number of patients on the books that moving people around is unfortunately what we have to do. I'm going to give you an appointment with me because I'd like to follow you up. You're registered with me. Come in and see me a week tomorrow.
Well, actually, I'll be honest with you, I expected you to give me
Why? Why would
for
you
not
do that?
taking me tablets. You know, give me a at the hospital.
But you are going to take them from now on, aren't you?
Yeah.
We talked ages ago about all the awful things that could happen if you didn't take your tablets.
Yeah, no,
There's nothing like having a brush with it to realise that you need to take your tablets.
Right.
OK?
OK.
I'll see you a week tomorrow.
Doctor, you've been absolutely brilliant.
You take care, OK?
OK. Thank you very much.
Bye-bye.
Donna Sands.
Sorry? Donna. Oh. God. You're getting worse, darling. I am a bit, innit? What am I like? Bloody jubbly.
Jonathan Stroud. Morning, how are you?
Oh, not too bad.
Good. Better than last time I saw you then. OK, so I saw you saw Dr. Nanda the day after I spoke to you?
Yes.
OK, fine. And he was saying that you're happier on apixaban than you were on warfarin, is that right?
Well, one of them keeps making me feel like sickening.
Okay.
When I keep being sick.
OK.
I don't know which tablet it is.
See, once he come off the warfarin, the bruising went completely.
Yes.
And I think now this new tablet's got into his system.
And I don't know if that's doing that as well.
I think it is. You know, the evidence behind reducing the strokes is so huge.
Yeah, that's what Dr. Nanda said.
Yeah, and I think most of us would want to have you on something like this if you can tolerate the side effects. John has multiple problems, many of which are quite significant and many of which impact on each other. He has had ischemic heart disease, he has problems with obesity, which is compounded by his heart failure. He has had quite serious problems with a bleed, a retroperitoneal bleed, while he's been on treatment for his atrial fibrillation, which is another problem that he has, which links in with his heart failure. So he's a very unwell patient.
Well, now and again I'll keep getting out of breath.
Okay. There are a lot of medications that he has to have, but that can cause problems and that can interact with different organ systems or with different medications.
He's got a great big bruise.
For example, apixaban, which is a medication to try and thin the blood, also means that you're at risk of bleeding in places that you wouldn't normally bleed. He has bruises all over his body, and he's also had at least one episode of a potentially life-threatening episode of bleeding because of his medication, and yet he needs it to be able to survive in other ways. It looks like the same bruising problems on the apixaban as you used to have on the warfarin, to be honest. I mean, we've been through this before, haven't we? Yeah, well, it's that whole thing about reducing your risk of the stroke risk with the AF. Yeah. And even though we had that more significant bleed before, didn't we? Yeah. With the retroperitoneal bleed. In the end, it seems like everyone still thinks it's better to stay on it, as long as you can tolerate the bruising.
Yeah, I can tolerate it, yeah.
The question about, I suppose...
Just tells everybody I've done it.
Well, yeah. Okay, breathing-wise, you're on such a high dose of furosemide, but every time we check your kidneys, they're absolutely plumb normal. Yeah. So I suppose we've got room to manoeuvre with that. We don't want you on so many medications that we can't monitor the interactions. We can't figure out which thing is causing you which symptoms, and which one's itch, and which one's this, and which one's that. Yeah. But at the same time, I also want your pain to be as under control as possible, because medication is kind of the only answers that we have, really. Yeah, I think I'm just not going to. I'm not going to mess with a good thing for now.
No. Okay. No.
In terms of follow-up, booked in for 8 o'clock. The loratadine is the only thing we're going to mess around with in the meantime, and we will see how we go from there.
Lovely. Thank you very much, Dr.
Nice
Joangie.
Lovely. Thanks very much indeed.
Bye-bye tonight.
Someone's been looking at British Airways on here.
What?
Someone's been looking at British Airways on here.
Why?
It's on the history.
No, I mean, like, why are they looking at it?
I don't know.
What's it booking flights?
Yeah.
Oh my god, that's serious. I can only think of one person that would do that, really. She probably needs a holiday again.
Oh, here we go. Sorry for the wait. I'm running quite late. Have a seat. Okay, so how is your ear?
What is it, the sodium?
Bicarbonate drops, yeah.
Well, I hope it is okay to go out, and I haven't been feeling it too much.
I've got a machine ready. The water is already in. Now, get it out. Right, so I have a look in here. Lovely. I think I'll wash it out.
Yay!
There's a risk of me perforating your eardrum with the procedure. Is it okay for you to do it?
Yeah.
All right, brave. So at any point you think it's painful or you want me to stop, let me know and I'll do that.
So it doesn't usually hurt, does it?
It's just a funny feeling. So I need you to hold this. There for me. Here we go. If the water is too cold, tell me. So I've got the wax, a big chunk out already.
It just feels straight.
Right.
Thank you for doing that.
All right, take care.
Bye, you too.
Bye-bye.
While I've got you here, is he all right? Is he sitting outside?
Yes.
Can I have a seat for just a second? We have less and less wiggle room as time goes on. I don't know how the longer-term outlook looks in that sense. Yeah. Because I think if he has a really bad spell and the kind of doses he's on of the furosemide, then I don't know how well he's going to do longer-term.
Yeah.
And that's just something that I wanted you to be aware of that's going around in my mind. And I wondered whether... Because I know you're really sensible about this sort of stuff, and I wondered what your thoughts were.
I had looked at it myself, and I thought, because sometimes, to be honest, he does tend to forget things. Sometimes I think to myself, has he got dementia?
Okay.
Which they did test him for, and he passed everyone but one. Yeah. But he does get quite shaky as well sometimes.
But I mean physically.
But
I mean like his heart, basically.
I had looked at it in his heart respect as well, and I've thought to myself, how much longer have I got with him?
I think he's generally really unwell. And I think we have few options to do anything other than try and just manage his symptoms and keep things going reasonably well. And I would like to have a conversation with him also at some point about things like DNA, CPRs. And I just don't want to cause him more anxiety than he already has.
No,
but I think as a good thing as a conversation.
This is why I don't really talk to him about it.
Do you think it'd be a good idea if I bring it up with him next time when you guys come back?
Yeah.
Quite a few of John's medical conditions are potentially life-threatening at any given time. For example, his ischemic heart disease, if that was to get worse, if his heart failure becomes more difficult to control and he's already on very high doses of medication, then that can be life-threatening. His atrial fibrillation can be life-threatening. Some of the medication he's on can also give problems that can be life-threatening too.
I mean, personally, if it was me, I wouldn't want him resuscitated. Because I think at the end of the day, he's not going to be the same man.
The chances of success are so much lower in him than in somebody else.
Yeah.
That it wouldn't be a pleasant way to go, is what I mean.
No.
And you're right, even if it was successful, what sort of function you'd have at the other end of it. Yeah, exactly.
Yeah.
I'm going to put him on a register. There's a register for people who we wonder might be getting to that stage of life, and so it means that we just keep more of a close eye on them. Sometimes we discuss them in meetings and stuff like that, just to get an idea of making sure that we're doing all the right sort of management.
Yeah, that's fine. That's fine.
How are you doing?
All right. I'm coping.
You see Dr. Bolger, don't you, quite a lot?
Yes, I've got to come and see her on Thursday because I had some tests done.
And she's aware of you as a carer and kind of stress and that kind of stuff?
No, but she's aware that John's got all sorts of problems.
You should book in for yourself to speak to me or her if you need to.
Yes.
All right.
Lovely.
Take care of yourself.
Sorry about...
No, it's good. It gave me the opportunity because I wanted to pick your brain about the right time for him, but I can't do that because I always see you together. So in fact, in some ways, it's worked out quite well.
Yeah. It's obviously meant to have been. Lovely. Thanks very much indeed, Dr. Jones.
Bye.
Bye.
At the moment, we've got a problem with him. He can't sit up. He can only walk in a walker. He won't stand on his legs. He won't do nothing at all.
Okay.
Like, he can sit up, but as soon as he sits up, he just flops himself back.
Okay, so he's nearly going to be a year now.
Yeah, near enough a year.
Okay.
Whereas my little girl, by this time, she was already walking. But if you lay him on his front, he screams the whole house down.
Okay.
If you put him in his walker, he whizzes around the whole house. But the minute, you take him out, you stand him up on his legs, he scrunches his legs up so you can't put him down.
So he's not standing even with support?
I'll show you.
Yeah.
There you go.
Okay, we'll check that in a minute. I need to do a full development assessment on him. So
obviously it is quite concerning.
Yeah.
I just thought it might have been where obviously he might have been a bit fat.
No, that's not the reason. No. Does he crawl?
But he literally does nothing.
Now, he was born by normal delivery?
Yeah.
Yeah. Were there any complications at birth where he had to be admitted in the neonatal unit? Yeah. Okay. And do you remember at what age was his head steady? Do you remember?
Even when he
How old was he?
He was quite young.
Okay.
He was 6 weeks old and he can move on his head.
Okay. The other thing I wanted to ask you is in terms of babbling and words.
He talks, he's got a full set of teeth.
So what does he talk?
House,
what word did he use?
Dad,
words? Dad,
mum,
okay, so
no.
Okay.
His words and his speech and things.
So he's
fine.
very good in interaction.
Yeah, it's very good with toys and things. He's very good with.
He's playing with the toys.
Yeah.
As a child grows and develops, he or she develops certain different type of skills. So the first milestone is called the gross motor skill. And this is basically the children using the large muscles so that they're able to sit, stand, walk, or run.
Right, I just want to do some assessments. So let's bring him here. Okay. All right. Hello.
He can move his arms, his legs, put his feet in his mouth.
Oh, good boy. Let's see what you do in your tummy.
Oh, okay.
Doesn't like it, does it?
No,
yeah.
He doesn't like this.
You're a very good boy, not crying.
Because obviously he's got something to play with.
Yeah.
He's not bothered, but even at home, if I've got something in front of him
So has he made any attempts to crawl?
No, he just screams the whole house down.
Let's make you stand now. Don't like putting your feet down, do you?
He doesn't do anything. Like with his feet, he won't put his feet down.
Right, okay. Shall we give it to Mummy? So what he has got is what we call is an isolated gross motor delay he's got, okay? So we need to refer him to a pediatrician, a children's doctor. A developmental delay refers to a child who has not achieved these milestones within the normal range. And this is really important because it's important to detect it early so that the intervention is done early, which has a significant impact on the outcomes. So it's really important that once we detect a developmental delay, we refer these children to the community pediatricians. So I'll do the referral today, yeah? So you will get an appointment to see them.
I want it done.
So don't worry, we will do the referral and the community pediatricians will see you in Upton Hospital. Okay? Yeah?
Yeah, that's fine.
Okay. Take care.
Thank you.
Bye.
All right, okay.
Thank you.
Rebecca Alger? Hello there.
Hiya.
Hi there. And how can I help you today?
Right, we got two things to see you about.
Yes.
One is last year she came to self-harm because she was depressed.
Oh no, okay.
And the depression is still there. We need some counselling for her.
Right.
So school told me to come to the doctors.
Okay.
We did talk about it last year, but nothing really.
They didn't do it.
Right. Talked about counselling last year.
Yeah, she needs counselling.
Yeah, but you haven't had any counselling. Okay.
She went to some group at school, didn't you? But
Yeah, and you're 15. And how is the mood at the moment then? How is your mood? do you
very
think?
bad.
Yeah.
She's really, really snappy.
Yeah. Is it okay if I ask you a few questions? I know you wanted your mum to talk, but it'd be useful to hear it from you if that's okay. So how long have you been feeling like this? Do you think it's been more than a year?
About 2 years.
2 years. And you've been self-harming, your mum mentioned. When
Yeah.
did you feel that low that you wanted to harm yourself?
I think it's about a year ago.
About a year ago. And what did you do at the time to harm yourself?
I used the razor blade.
On your wrists or somewhere else?
On the arm.
On your arm. And then did things get better before you came and see me? Because you haven't been in for a while about this problem, have you?
I haven't had the urge to self-harm, but I still get the depression thing.
Okay, so you're still feeling quite low?
Yeah.
Okay. Do you have thoughts about harming yourself or ending your life or anything like that?
Not as bad.
Not as bad. Okay. But last year when you felt so bad that you wanted to harm yourself, that was the worst it's ever been, do you think?
Yeah.
And now you're still low and you feel like you haven't really had much support with it. And do you know what it was that triggered your low mood or your depression at the time?
Bullying.
It was school and we had exams going up, so it's stressful.
Exams and in school. Do you have any friends at school?
I've just recently lost 2 of my friends.
Okay. What's happened with them?
I didn't get along with one of them.
So that's been quite a stressful time for you as well. And are the teachers aware of your mood at school? Have they been trying to help or support you? And what have they?
Not really.
Okay. And have you seen a specialist about your low mood? So yes, you've seen us in general practice, but have you seen anyone else about your mood at all?
Yeah.
We did. We went to see CAMS. Someone in CAMS.
So you saw CAMS, and how long ago was that?
Last year, wasn't it?
And did they offer you any follow-up after you'd seen them, or did you get better and not need it?
Didn't do anything. They were supposed to get counselling, but
Oh, so they were
nothing came of
supposed
it.
to... Right, okay, that's fine. Well, we definitely need to get you some support, don't we? CAMS, I can refer you back to them, but I can write a letter with it just to say that it's
She needs the
counselling that you need.
Yeah.
So we can do that. Now, you are very young, so we like to see you regularly here as well to make sure that, you know, your mood's doing okay, because sometimes it can just help to see the GP from time to time and check on your mood as well.
Yeah.
Would you be happy to see me back in a couple of weeks as well? Yeah? Okay. And if you yourself start to notice that your mood's dropping down a bit low, will you come in and see us, or let someone know in your family and book in and see us? Yeah. And do you want to talk to me on your own today, or are you happy with everything we've talked about? You can, yeah? Are you sure? Okay. All right. So I've got that letter, so I'll dictate a letter back to them.
Yeah.
Can I book you back in to see me in a couple of weeks
Yeah,
as
yeah.
well and see how you're getting on?
It'd be after school, please.
20 past 5?
Yeah, that's
5:30?
fine.
20 past 5.
That's lovely. Thank you.
All right, so Tuesday 5:20.
Thank you very much.
Right, take care then. Bye-bye.
A lot of sick people around today.
So I have some happy people in.
You see, I'm happy. I'm not seeing it.
Hello, come have a seat. How are you today? Tell me, how can I help you today?
In short, I have thrombosis on my right leg. I done a bit of research myself. It's probably because I've got a catheter at the moment. I had a surgery.
For Fournier's gangrene?
Yes, that's right. And that's why I thought it's best to have a look with the doctor.
Sure.
Just to make sure it's not anything which could kill me or something like that.
Okay. Karel had a very rare condition which is called Fournier's gangrene of the genital areas. The key symptoms of gangrene of the genital areas would include pain, extreme pain, swelling, and fevers. And the patients usually feel very unwell and end up in the hospital within few hours. In my career, I've seen only 2 patients. One of them died in the ITU, and the other one is Karel, who was promptly treated in Northampton Hospital. Since then, you've been okay. Only how many days since you had this trouble then?
I had it maybe 3-4 days now. So at first I hoped it would maybe just goes away.
Let's go and have a look.
Okay, thank you.
Karel suffered with urinary stricture, which is a tightening of the urinary tract because of the gangrene. And he couldn't pass the urine properly. So the hospital doctors decided to put a catheter through his abdomen to his bladder. Show me the area where you want to show me.
And this one is a funny problem.
So in the last few days you felt this thickening, is it?
Yes, and as you can see, it's a bit like changing color, a bit darker than normal. And it's painful all over here.
All over there. So what about here? The legs are fine.
This is fine.
Uniquely, with genital gangrene, the blood vessels can get clots in them, and they can end up with very thickening of the veins and pain in that area. But in Karel, I found the whole of the thigh area was full of tender or painful veins, and I felt we probably need to exclude clots in the deeper veins, and that's the reason why I had to send him to the hospital. So if you can take this to the A&E and show it to them. All the best. Take care.
Okay.
Bye-bye.
Have a nice day.
Cheers.
Hello, come in, Terence. I'm really sorry for the wait. I know you've been waiting for a long time. I had a very unwell patient that I had to look after.
That's all right. No worries.
Please?
I've got all the time in the world, my dear.
Right, how can I help you, Terence?
Coughing up phlegm with blood in it. Started Monday. I just thought it was something that I need, not like I'd had shredders that morning and probably got stuck in his throat and stuff from there. So instead of swallowing it like you normally do,
Okay.
I put it into a tissue and it was horribly black and stuff like that. On that day, I did about, I suppose, about another half dozen times, and every time I did it, there was blood in my sputum.
So what colour was it?
It was red.
Bright red.
Yeah.
Okay. Yeah, it is, isn't it? Any other symptoms apart from the cough?
No, nothing else at all. No.
So this has been since
Monday.
A couple of days.
That's right. Yes.
Okay, right. Have you had this before?
No.
Okay. Any shortness of breath?
No.
Okay. Do you smoke?
No.
Any stomach problems? Any?
No. When I'm on
Lansoprazole. Okay.
Yeah.
And do you have any pain in your tummy?
No.
Any
no
symptoms
pain
of heartburn?
No, I've got no
reflux and
heartburn.
heartburn symptoms. Any pain or difficulty in swallowing?
No.
No, nothing of that sort. How is your appetite and weight been?
Oh yeah, no, that's fine.
Okay, that's been fine.
Yes, because
okay.
I'm on a more or less a good diet anyway.
And how are you feeling in yourself?
I'm fine, thanks very much.
Right. Okay. Let's check you over. I'm going to have a look at your blood pressure, temperature,
Yeah, sure,
have a listen
sure,
to your
sure.
chest. Okay, was there anything in specific in your mind you were worried about that you wanted to speak about today, or?
Basically, just hope it's not that dreaded word.
How are you? Just take a seat. How can I help? Yes. Since when?
Started going downhill Friday.
Mm-hmm.
Yesterday was bad.
Mm-hmm.
And today it's getting worse.
Have you got any fever?
I've been sweating like
Okay.
there's no tomorrow.
And the medications that you're taking at the moment, in terms of your inhaler, you're on carbocysteine, Phyllocontin, Symbicort. You're taking those all the time. Okay. Not a smoker?
Oh, I am.
You're joking. Really?
I know.
How many do you smoke a day?
About 15.
When somebody who is in discomfort smokes, I'm surprised, but only up to a point, because smoking is an addiction. And so what we have to do with Natalie and people like Natalie is help them. And in our area, we have one of the highest quit rates in England. Have you seen Sheena Kapila or our Stop Smoking advisors?
I have tried.
And when was the last time you tried?
Just before Christmas.
And was that with them, with Sheena?
No, that was by myself.
No, there's no point in trying it yourself. You won't succeed. You have to do it properly, like most things in life. The evidence is that if you have the right information and a one-to-one stop smoking advisor and the right prescription, it makes it much easier to come off. And that's going to be really important with you. But let's just get an oxygen monitor. Good. Good. Your oxygen saturation is quite good, really. Good. Just open really wide. Say, oh. That's good. Good. Okay. So what we need to do is we need to give you a nebulizer and some oxygen.
I had one this morning.
At home?
Yeah.
Yeah, but you don't have oxygen at home. Yeah. Okay. So I'll carry that for you.
Thank you.
Take your time. So we'll just give you some oxygen and some Ventolin and then see how you get on.
So you seem to be an active person.
Well, I try to keep active, yes.
Okay, it's 145/91. Better than last time.
Yes, oh, it will go down. The ones I do at home, I'm around about 140/80.
Okay, so that's your usual blood
Yes,
pressure.
that's my baseline at the moment.
And how about your bowels? Are they been fine? There's no black or fresh blood in the stools. Okay, right. Can I have a listen to your heart? If you can take off your jumper. So that's a bypass scar, isn't it? Yeah. And I would like to feel your tummy as well. If you can come and lie down here for me. You okay?
Yeah.
Any pain there when I'm pressing there? Yeah. Okay, that looks fine. You know, I couldn't find anything worrying on examination. Your heart rate is fine, your heart sounds are normal.
Right, okay.
And your chest was clear.
Right.
Okay. But I understand your concerns about, bringing up blood, and we would be concerned as well if you're bringing up blood in the cough. We need to know why. We need to make sure it's not coming from the lungs, coughing up the blood.
Yes.
We need to do an urgent referral,
Right, okay.
to rule out any possible cancer.
Right.
And I'll do it as a 2-week referral. Do you think you can go to the hospital to get an X-ray done today?
I suppose I could.
So the first thing would be to rule out the lung problem.
Right.
Yeah. And that's why a chest X-ray would be helpful to see if there's anything worrying.
Okay.
And it's a lot to take on, but I think we still have to do it.
Yeah.
You've been well in yourself, and it's only been 2 days since you've had this symptom. So shall we organise these tests?
Right. Well, we're not going to know until we get them done, are we?
Yes. We need to see you back with the results, yeah? Okay. So let me go, and do you want to come with me? Yeah. And then I will get in touch with you after I get the X-ray report, yeah? Say we meet up on Monday, okay? Down to the nurse now, yeah.
Oh, thank you very much for your help.
Right,
Thank you.
take care then.
All the best, yeah.
Thank you for your time.
No worries.
And it's all good news. Thank you.
Just wanted to see you. See you later.
Good to see you.
I'm glad to see you again.
It's always good to give goodish news, yes.
Yeah.
Hello, Final Surgery. Nikki speaking. How can I help?
Massini James, please. Hello. Hi. I'm Dr. Taylor. Nice to meet you both. How can I help?
I'm 21 weeks pregnant, and I saw my midwife on Tuesday.
Uh-huh.
And I was talking to her about how I'm feeling lately. So
Okay.
I'm feeling a bit down. I'm on antidepressants.
Right, okay.
So I'm on fluoxetine at the moment, 20 milligrams.
Okay.
So she's suggested that I come on meds.
Okay.
Or that I go on to a safer, low-risk one. I'm just finding I'm not coping.
Yeah.
I'm slipping into a depression. I don't think my mind's in a healthy place, so...
Yeah. Okay, so obviously you've been going through a lot recently. It sounds like it's been a fairly involved pregnancy with all of this going on. And when you had your daughter, did you have any mental health troubles after she was delivered, in the immediate period after delivery?
I was fine the first 3 months, but I found after 6 months, that's when I actually... I slipped quite really badly.
Right. When I saw Mrs. James, she was 21 weeks pregnant. She had been diagnosed with depression prior to pregnancy and was already on medication when I saw her. There's understandably a lot of concern from expectant mothers as to whether they should be continuing with their antidepressants during pregnancy. We absolutely try and discourage patients from suddenly stopping medications during pregnancy because we know that can be related to sort of worse outcomes in the long term. Have things gotten to the point where you've had harmful thoughts?
I'd say yes.
And can you tell me a bit more about these thoughts?
It's difficult to say out loud. So.
Okay, would you rather it be us in the room?
No, it's not that.
And any thoughts about harming others? Have you had any thoughts about that? No. Okay.
No one, no.
Here we go. Christian, take a seat, Christian. No, not that's mine, mate. Right, how are you doing?
Good, thanks, yeah.
Yeah? We need to take your blood pressure, apparently.
Okay.
Because I haven't done that for a while.
Yeah.
Let's do that. So if you pop your coat off. Have you got any complaints or worries or anything, or is life really good?
Yeah, I was going to ask about the medication. I don't know if you're going to change it or not. Now the results from the hospital.
Let's have a look. Yeah. I think the person that would change it would be your psychiatrist.
Okay. I haven't seen them for a while.
Yeah, you need to see them. So Christian, I've known for many years, and he has been suffering from a type of psychosis with features of paranoia. If you look at mental health issues, you can divide them into psychosis or neurosis. Psychosis being things like schizophrenia, where the person involved doesn't realise that they have their own mental health issues. A neurosis, like depression or anxiety, generally occurs to somebody and they realise they have their own mental health issues rather than the rest of the population. Are you still going to the gym?
I haven't been for a while. I need to start getting back.
Yeah.
Yeah.
What are you doing with your days now?
Being lazy.
Being lazy? Okay. Run me through a typical day for you, Christian.
During the week, I go to see my mum and help her out.
Yeah.
Or I just sit down and play computer.
Okay. What are you doing on the computer?
Play games.
Play games, yeah. What's your favourite game?
Mortal Kombat, FIFA.
Yeah?
Like those kind of games, yeah. Or sometimes go to cinema, maybe.
Yeah, okay,
Go to
yeah.
cinema.
You're not seeing any horror films anymore, are you?
I don't really. I've cut down on them now.
Good.
Quite a lot. Yeah. They're no good, are they, really?
They're not good for you.
Yeah.
I think I think you've got enough problems looking after yourself without them compounding things. You went through a really bad time at that stage.
Yeah.
So you're still living in your own place, though?
Langley, yeah.
Yeah. Yeah. What about alcohol? Do you drink much or not?
I've cut down a holiday drink, you know.
Yeah. So what? Every day?
Even fizzy drink, I've cut down.
Really? Good.
Too much sugar in that, isn't it? Make you get fat.
It does, particularly if you're not going to the gym.
Yeah.
Okay, so I think just to clarify things, so stay on the medication. We're not going to change it, okay? But we will need to do regular blood tests.
Every 3 months.
Will you be able to come back every 3 months to have that done?
That's fine,
Yeah. Christian is on a medication called olanzapine, and he has been on it since as long as I've known him. We do a regular mental health check on everybody with mental health issues, including all blood tests as well. Some of the antipsychotics, for instance, may have a tendency to cause diabetes, for instance. So we'll be doing a regular yearly check to make sure that that hasn't occurred. So we'll do that, and I'll keep an eye on those tests just to make sure that there's no... And if there's any problem, if I think things are worsening, then I'll call you back in, OK? Stay on the medication as it is, OK? The things you've got to do now are join the gym, really important, because I think that helps everybody. OK? Yeah. Exercise is really good. And also it stimulates you a little bit. You don't want to be stuck in the house all day. So stay on that. Blood test for you to organise, OK? Gym for you to organise.
Okay. Get straight on it.
Good on you. OK, mate.
Take care.
OK, you take care.
You too. Good to see you.
Good to see you as well. And if you're worried that anything's worsening in any way, then give us a call and come back in, yeah?
Okay. Thank you.
Good on you. See you, Christian.
Okay. Thank you.
See you, mate. Bye-bye. And they are. Is that the new uniforms?
We're wearing the t-shirts. Us newbies had first the shirts, but now that we all got t-shirts. It's because it's too hot, the shirt.
It's a nice colour.
Do you think?
Goes well with the pink.
It gets dirty really quick, though.
Yeah, same as these ones. Tell me how bad these are, these shirts, these NHS shirts.
Yeah.
Oh, that rain, you know that rain we had on yesterday?
Would you like me to write it on here?
I created 3 wet t-shirt competitions and won every single one.
Oh, no.
It was actually all a see-through. Only thing was hiding everything was that.
That was too funny, actually.
The thoughts that come into our mind, I know that they're not healthy, but I also know that they're not.
Okay.
They're not ones that I would do.
What sort of thoughts are these?
Like I wish I wasn't pregnant.
Okay.
You know?
Yeah.
Maybe things would be better.
Yeah. What sort of thoughts are these?
Like I wish I wasn't pregnant. It's causing a lot of problems, so... And with us, and so that's why I just feel if I can try and get better mentally.
Yeah, of course. Well, look, you've done the right thing by coming in. I always say to my patients that medications are only part of the solution here, and that really the actual cure is the support and the psychological therapies that we can often direct them towards. Mrs. James had expressed some worrying thoughts, and this did make me also quite concerned and want to get slightly more urgent help for her. So I think what I would like to do is get sort of more specialist advice before we potentially change anything. I think ultimately what we probably need to do is get you in touch with one of the community mental health team who can kind of guide you throughout the rest of the pregnancy. I think also we need to think about the period immediately after you deliver, making sure that there's enough support for you there, because that'll be a critical time as well, because obviously with twins it's going to be challenging. There is a special team that look after women who have mental health problems in pregnancy and then also in that immediate period after pregnancy as well. And I wonder whether you would benefit from input from them as well.
The Crystal team?
Yeah.
We're already part of it.
So you already are part of them? Okay, brilliant,
Crystal,
okay.
yeah,
We've got drug and alcohol history, so it's...
Okay, and just to ask, with the drug and alcohol, is that something that's an ongoing issue during pregnancy, or is that something that...
Oh, no, I'm clean now.
Okay.
4 years in December.
Okay.
So, yeah.
All right, okay. There's a lot of evidence linking drug and alcohol addiction with mental health problems. In the case of Mrs. James, in fairness, she had been clean for 4 years, and I'm not sure in her particular case there was a direct relationship between her past history and her current presentation with her anxieties. But it is always something that we bear in mind when we're targeting the type of support that they need. So I'll contact you before the weekend.
Okay.
It may be that one of the mental health team, I can give them your details if you're happy with that, and they can contact you.
Okay.
Is that all right? Yeah?
Okay.
Perfect.
Thank you.
Okay.
Thank you.
Take care. Bye-bye.
Most people are trying to escape the heat.
Thank you. Oh,
Are you okay walking up the stairs?
I need the exercise.
Good. Well, don't we all?
Really like that smell. Fresh linen, isn't it? My house is full of air fresheners. Is it? Yeah, I do like that one. There's one in the hallway when you walk in. There's one at the top of the stairs. There's one in the bedroom. There's one in the spare room. There's one in the bathroom. There's one in the living room. There's one in the kitchen. Okay.
Right. How can I help?
Well, you gave me antidepressant pills,
Yeah?
but they don't work.
Oh, really? And is your mood not good?
No, it's not good. It's getting worse.
Really? And in terms of feeling down, feeling depressed?
I feel down, yeah, all the time.
Really? Yeah.
All the time.
Would you like some talking treatment?
No.
No? You don't want...
I sit in my house alone all day for the most part, and I go to bed at night.
Do you,
the same situation.
Do you feel lonely?
Yes.
You do, yeah. How depressed do you get at times?
I think at the bottom of the pit at times.
Just sit forward for Miss Bull. Just take your temperature. How fed up would you feel?
Well, I don't see any future,
Yeah,
if you know what I mean.
I do, yeah. That's normal. So what do you do all day? How do you fill your time?
Doing nothing, usually.
We know that people who are lonely tend to become depressed, and the ordinary difficulties of life that we all experience become more of a burden for them. So we would call that a neurotic development.
I just wish I had an answer to it all, but I don't.
Well, I think there are people that we could get to help you to come in and visit you if you'd want, that would break the monotony. And there's a Slough Seniors group, which is very good. Age Concern will do it. And even the Fire Brigade have a loneliness service that is really very good.
Yes.
I'd like to see you with a fireman or two around. I'm sure that would cheer you up. But it's a very good service. I think that companionship is really important.
Yes.
We all need it. And then once you get a bit of it, it brings you out of yourself.
Yes.
And so that, I think, is the way ahead. And I think I'll organise that and get people to visit you. So I'd like to change your antidepressant medication.
Do these pills raise the spirits, or...?
They do raise the spirits, and they raise the chemical in your brain, serotonin, that is responsible for the feel-good factor.
Good.
And sometimes in these situations, that's what runs low.
Yes.
Or it's consumed too fast by the nerve endings.
Yes.
So there's not enough of it there.
I see.
And what this does is it replaces that.
Yes.
And that's how it works. So you can give me a call anytime. Just let me know how you're doing. And I think those two things together will make a big difference. Good. Yeah.
Oh, dear.
Good. Because we're growing older in ever-increasing numbers, then unless we get really good at tackling loneliness, we will be paying the price for not doing so in all kinds of ways in society. And that makes loneliness a key risk factor. And I think it's one that we would ignore at our peril. Good.
Thank you very much.
Not at all. Nice to see you. Yeah, you take care. Do you want me to walk with you?
No.
You sure?
No,
Yep.
yeah.
Good.
Can we have a bit of that now? Yeah, that's fine. We don't do it when there's patients in because they may be suffering from asthma.
Amy Rosen? Good afternoon. Come and have a seat. Long time? No see?
Yeah, how long has it been?
It's been probably a year, I think.
I went out a few days ago with my friend and we were just going in a park, but I felt like I had to sit down. It was just too much for me to cope with. And I was like, why do I feel like this? I should be, have energy. I just didn't feel like that. I feel like nowadays, I just feel like I always need to sit down.
Everything is a chore, tiredness, lethargy.
Yeah, and even like I'm a bit afraid in case I might faint or anything. Not all the time, sometimes. I just don't know what that is about. Any idea? Or?
Tiredness can be due to 2 or 3 reasons in your situation. One of them is, of course, depression can make anybody tired. And the second thing is any other medical condition. Amy lives with her mother. She's got Asperger's syndrome. Asperger's is a mild form of autistic disorder characterized by awkwardness in terms of social interaction and difficulties in non-verbal communication. Because of that, she is socially withdrawn and hence associated depression. The third thing is any medical condition like diabetes or anemia, low hemoglobin, all these can cause that tiredness, lethargy.
I think it's a bit bad for both of us at the moment, because, to be honest, Amy's... Yeah, it'd be great if any physical reason was discounted, but the point is, the life she's living at the moment is bad for her in all sorts of ways, and it's not changing at all. She's so isolated. Her day, she very, very rarely sees anybody. It's not good.
The family dynamics of living with somebody who has Asperger's or depression can be very traumatic. They should receive help, support. They need to have their own sort of respite. Otherwise, we end up with a family full of depression. And that is not a good sign for the mental well-being of that child.
Amy missed 3 days of Prozac, and I kind of felt that she got more aggressive and verbally and, to be honest, a bit other way.
So please do make sure in the future not to miss, even if you miss not more than a day. Yeah. When did you last have any blood tests?
I think about 9 months, 6 months, 7 months ago. I'm really not sure. I'd be more than happy to have a blood test done. I just want to know, because it's just really frustrating and worrying knowing what's going on. You just don't know. And
have you managed to have all these interventions and help and talking therapies and CBT and all that stuff?
I will be there next week.
That would be the right way forward. Okay?
Thank you very much.
All the best. Bye-bye. Take care.
Here, Mum. Here, Mum. Be nice, nice, nice. Oh, yeah. Whose bright idea was it to make self-check-ins for doctor surgeries? You need shooting. They never work.
Actually, my doctor's surgery where I go, it works.
Hey, well, no.
How can I help?
Okay, so we think that Damien might have ADHD. There's a lot of stuff going on with Damien, his behavioural problems. We spoke to him last week and he said that he's got little miniature voices in his head that tells him to do bad things, and when he's doing the bad things, he also gets another voice in his head that tells him to stop doing the bad things. His behavioural problems have been ongoing for quite a few years. But to be honest, I think it might be time for a referral with Damien, because I only know a certain amount. He has got a lot of anger issues.
And give me some examples of his behaviour.
Behavioural problems. He bullied a child in school for no reason whatsoever. When I asked him why he did it, he turned around and said, I don't know. And with his brother and sister, anyone touches his stuff, it's like World War III in his own little world. There's a lot of anger underlying in there.
ADHD sometimes gets used as a sort of catch-all for behavioural problems, which formally it isn't, because there are formal diagnostic criteria to be met. But it often presents with a behaviour problem.
You know, when he's first to play on his own, he's the class clown at school. There's just very many things that are kind of pushing me towards that. And
Do you think things are getting worse?
yes.
Just for you, I've come to a closer room.
Oh, thank you.
This keeps coming up on my mouth, and I don't know what it is. I've tried pseudo cream, I've also tried antiseptic cream, and also tried putting neat aftershave on it. Okay.
This one's still swollen quite a bit. I call them Gert and Daisy. Gert's fine.
It's all coming off nice and easy anyway. Let me just plan and brush out after this.
It's really painful around the elbow.
Right, well, I promise not to chop your elbow open today.
He will open up, but he's got scars on his forehead from
Since
where...
when I was born, I used to get so angry, I used to stomp up to my room and start scratching my face.
Yeah. Like, if he's ever angry, he can't sit still. He's constantly moving.
Okay, what's the situation at home?
Situation is...
Dad around?
Dad's still around, yeah. We've split up.
And is it the same father for all three kids?
Yeah, Dad's still around.
And there's no problem there, there's no issues there between father and son or anything like that?
No, they get on really well. Dad picks them up from school, I drop them to school. They get all their bonding time.
Okay.
Perfect.
Right.
It's just trying to figure out what it is and then deal with the situation.
Yep.
Because it can be quite difficult, because I also have a son who's autistic. So
Yeah.
it can be
Is that older or younger?
younger.
Mm.
And they just clash all the time.
Yeah.
They're never
Okay.
nice.
All right, we'll send you over to the other doctors, Damon, all right? And they can have a look at you and see whether you can work this anger thing out, yeah? There wasn't enough in the consultation to say he had ADHD, and I'm not so sure that he did have, but the story about how he was behaving at school, his lack of attention at times during the consultation, there was a possibility of it. But more broadly, I had a 10-year-old child in my consulting room who clearly had some behavioural problems, and so referral to the community team was justified on those grounds, irrespective of whether his diagnosis was ADHD or not.
It's all right, mate. He's going to try and help.
Let's see what they say. Management can be from talking through to drugs and anything in between.
Yeah.
Okay.
No, that's fine.
If it is that.
Yeah.
ADHD can be treated in terms of therapy, in terms of talking therapy if it's a behavioural problem, but also with medication. It's quite a difficult condition to treat and requires medication being taken sometimes for many years. Okay. Is that all right? Yeah? I'll write to them, you should get a letter and a response.
Brilliant.
And take it from there. Okay, Dan?
All right.
Take it easy.
Thank you very
Bye-bye.
much. Cheers.
Bye-bye.
Bye.
I thought I'd come downstairs today, obviously, just to help you out, you know. What's happened since last week on the all the rest
Well,
of
I
this
took
front?
those tablets you've been giving me, which is helping to knock me out, literally, yeah.
Do they knock you out?
Yeah, well, I just seem to be sleeping a lot better or a lot more. But
Okay.
I'm still having down days.
Yeah.
Still having nights where dreaming, yeah, and it just drags you down, yeah. We're not, I don't know what you call them, nightmares or whatever. I just don't know. I just don't know where I'm going or how to get around it at the moment. Everything at the moment in my life just seems to be a fight.
David is well known to myself after seeing him regularly over more than a decade now. He has a number of medical issues which have caused him great grief over that period of time. More recently, he has injured his hand following a fall brought about by an apparent altercation.
Maybe I have something similar to like ADHD or something, because all my life I've been like it, yeah. But in the 60s, he was just a bad boy, yeah, and he was sent off to naughty boy school, which was great because I enjoyed it down there to a certain degree.
Anger and aggression are both feelings that everybody has at various stages during their life. Until an emotion starts affecting your lifestyle or affecting other people around you, then it's probably a normal emotion. But once you cross that line and everybody else is being affected or you're being affected, your health is being affected, then it becomes a problem.
Rugby has always been my release of energy, yeah. When I played rugby and then in the army, yeah, me and a corporal had disagreements, right, when I first joined up. And we went off down a boxing ring, hit the shit out of each other for 3 minutes. And after that, it was as great as anything, yeah, you know what I mean?
You're not able to do that quite as often these days. In fact, that was part of my school rules when I was at school, was that if you had a disagreement with somebody, you could go, we had a school disciplinarian, and you could go to him and ask to box the other person, and he would provide the gloves and watch the match. But, and the big but is that to do it, you both had to have 6 cuts of the cane first each, because they didn't want everyone to do it.
I came to school, it never worried me. I came first day of secondary school, yeah. And the headmaster went to me, is this how we're going to go on? I went, maybe.
What about talking therapies?
Well, I went to them before, didn't I?
Yeah.
And we did 6 sessions, and they're telling me, oh, well, you know, you've got to try and keep you cool. Well, I don't know. We could try.
Let's try it again. Yeah. OK, because I think, you know, and also when they do the assessment, you need to say, look, we tried something in the past. It didn't really work. You know, they've got so many different ways of doing things now that it might be worth them just trying a different track this time.
It's worth a go, yeah. I'll give that number a ring and see where we go, yeah?
Good. OK, mate.
All right, thanks a lot,
See you, mate.
Dave.
You take care.
No problem.
Bye-bye.
There's by any chance having square batteries, is it?
If you can't fix it, don't worry, you can pull it off the wall and chuck it out the window.
Hello, come and take a seat. What can I do for you?
My psychiatric nurse sent me what it was. I'm getting like 4 hours sleep a night, and I'm getting pains in my knees and my thighs, and stiffness in my back as well.
Okay.
And could you write me a letter, just a quick letter, so I can post it with this? Just a few paragraphs to say like that I'm schizophrenic.
I'll just print out your medical records. You can send those with you. You smoke, Mr. Richardson?
Do I smoke?
Yeah. OK. Can we check your blood pressure while you're here? OK, just relax. Are you drinking much alcohol at the moment?
No, not really. 2 cans a day.
Cans of what?
Stella.
Schizophrenia is a long-term psychiatric condition that's characterised by several sets of symptoms, one of those being hallucinations, which is where the patient sees or hears things that don't actually exist. The other one is delusions, which is that they believe in something that you can't give an explanation for. And those 2 problems in turn can then lead to sort of muddled thinking, which is often how they present. So you're on vitamins and you're having the injection, is that right?
Yeah.
Okay.
That's what I think I'm getting side effects of.
Yeah, the haloperidol.
My jaw goes and everything, and I can't get it to realign in it.
Right. When are you due to see the consultant again?
I'll see her on Thursday.
I think what you're describing is some of the side effects of the haloperidol, so you need to tell her about that.
I've already told
You already told her. But I think what we'll do today is to just run some blood tests and check we're not missing anything. Is that okay? Yeah. Approximately 1 in 100 patients will experience schizophrenia in their lifetime. Some of them as a one-off episode, some continuing on to be a more long-term problem. So that's your vitamins, OK? That you need to put in that envelope and send with you. And if you take a seat back out in reception, the nurse will call you for some blood tests.
Right,
OK?
Thank you.
There might be a little wait, but we need to get them done. All right. Bye, Mr. Richardson.
Good at Verdi.
Hello, doctor, how are you?
Hello, I've got a student with me, is that okay?
That's all right.
Great.
I don't mind.
Good. Have a seat, thanks for waiting.
The problem is my medication, and I need it because of my last card.
What, the pharmacy said they haven't got it?
Yeah. They have to order it, it's going to take time.
Okay, so how can I help?
I just wonder if other tablets can I take?
So, this is a brand of lithium. So the only thing we can do is give you a different brand. But the problem is, these different brands have different strengths and may not work in the same way. That's the difficulty. Gerdip has a condition called bipolar affective disorder. We used to call this manic depressive disorder. And this is a condition where the mood can swing between being quite low and then sometimes being quite high. Bipolar affective disorder is not normally cured. We normally treat and manage it. We use lithium because it's a mood stabilising drug. Let me just have a chat to them. Stay here, okay?
All right. How are you finding it? Yeah, doctor's not very easy, I tell you. Our doctors say like a lawyer. My dad said, be a lawyer. And I said, no, I don't want to be. I want a businessman.
Okay, how are you?
Right, the thing is, I'm really, really depressed.
Okay.
And I don't know if it's my health or what,
Okay.
what it is.
Okay. What do you mean depressed? Like, what do you mean? How do you feel?
Like, every day I don't want to get up.
Yeah.
Things like that, you know.
Yeah.
I know something's wrong with me, but I
Yeah.
don't know what.
How long have you been feeling like that for?
For a long time, about 3 or 4 weeks, and I don't know what to do. You know, I was, narrowing it down where it's coming from.
Yeah.
It's nothing to do with the house. It's nothing to do with my family, my husband, nothing.
So home life is good in that sense?
Yes, it's brilliant. And there's a wedding coming on and everything, and I just wanted to see if this could be...
Health related?
Yeah.
Was there something specific that you're worried about? Any particular problems or any other physical symptoms or anything like that?
Yeah, because sometimes I get a headache or I feel dizzy.
Okay.
And that's what made me think it must be
When do you get the headaches and dizziness?
when I get really stressed. And when I get stressed, my head feels like it's going to break.
Yeah.
That's how stressed I get.
So does that tend to happen more when you're at work, or is it like in the evenings when you're at home just before bed, or how does that work?
I think it's generally at work. So thinking maybe could it be me physically ill?
Yeah. So we can definitely have a look at that.
Yeah.
I just want to ask you a few quick questions. Though.
Okay.
Do you ever have thoughts of sort of hurting yourself, or thoughts of being better off dead, or anything like that?
No, sometimes I do that.
Yeah.
But I wouldn't do it.
What kind of thoughts?
I know I'm not going to do it. I'm
Yeah.
a coward.
Yeah.
But, I feel maybe everybody's better off if I'm not here.
So today, I'm going to do your blood test.
All right. I brought this early morning thing.
Thank you. You're the only person that's bought one today.
For somebody who's 87 knocking on the door of 90, I would be absolutely loving it if my blood tests were like this.
Oh.
I appreciate what everybody do for me.
You're welcome.
Especially you.
Can I check your blood pressure? Perfect, as always.
Oh, good.
And now, it's the first time ever I won't have to pay for my prescription.
You don't have to.
I'm 60. It's still the cheapest place in the world. We are very lucky.
Okay, I've got 2 options. Right. Okay, they've got 15 capsules there. Option 1 is to take what they've got, and then we'll see what happens.
That's what I'm thinking, I think.
Okay. Option 2 is to try a different brand, but we'll be guessing the dose.
If I say option 1, be better.
Okay, so take what they've got. The problem with lithium is it's one of those few medications where you need to have the same tablet from the same manufacturer because the body will absorb and treat different manufacturers' versions of lithium in a different way. If you don't have enough, it doesn't work, but if you have too much, you start to get really unpleasant side effects. And if you take too many tablets for too long, this can be ultimately fatal. And so we have this now what we call a therapeutic window where we give medication and then we do blood tests to make sure that the dose that the patient's got in their bloodstream is between the top and the bottom level, so they're having the right dose to give them the effect. This happens sometimes with manufacturing medicines, so I'm really sorry this has happened.
All right.
So go to the pharmacy.
I'll go now.
Go now. Give them what they've got, okay? And hopefully they'll be in next week, but if not, come back and see us like you have done and we'll give you the other stuff. Thank you. Good luck. Take care.
Thank you.
Bye-bye.
Bye.
Have you ever tried doing anything like to hurt yourself?
No, never.
No.
I never go that way.
And family-wise, you got kids at home, or?
Yeah, kids, everything's brilliant. We all live together.
So do you find that stressful, or do you?
No.
No, enjoying it?
Yeah.
Okay. So it sounds like it is more to do with the stress and the psychological kind of element, you know? It sounds like maybe the depression side of things might be true. But I don't mind looking at sort of whether there are other physical things, so we can do things like blood tests and we can check that there's not something like thyroid or diabetes
Yes,
or
because
anemia,
I'm
that kind
wondering
of stuff.
maybe it could be physical
Yeah.
that I'm feeling like this.
So why don't we do this? Why don't we start with doing some blood tests?
Okay.
I'll book you a follow-up with one of us, okay, to kind of talk through the blood test and then maybe talk more about dealing with how you're feeling rather than physical stuff, as long as that all looks okay.
Now, do I need to have a rest from work, do you think?
Yeah, possibly. So if work is the main stressor, then I don't mind, yeah. How long do you think you need off?
Maybe just 2 weeks, just to get...
Yeah, sure. Just to get your head straight. Do you think you need something like counselling?
I don't think it's anything like that. Just I think it's just pressure, you know. And it's getting to me too much.
Okay. I'll do the note for work.
Okay.
I'll give you an appointment to come back and see one of us.
Okay, thank you very much.
No problem. Take care. All right.
Okay, thank you so much.
No problem. See ya.
Okay, bye.
Bye.
And the first letter of your surname. Yeah? Who did it say you're seeing?
That's brilliant.
Oh, amazing, see?
You're going to be out for job shortly.
Oh, trust me. The amount that we have to do, it's easy to just check yourself in and go straight through.
See, you're in a good spot there. You can see what the things are up on the wall, can't you?
Did it say who you're seeing?
Thank you.
No worries, too excited. How are you?
I'm actually feeling a little bit better than I was a couple of weeks ago. I actually did take the tablets, but the problem is that they were making me feel like I was losing days. I couldn't remember anything. They were just a bit too, well, really strong, weren't they? They make you feel a little bit worse in the morning.
So, was that? Are you still taking them, or have you stopped them?
I stopped taking them because I couldn't handle them. And I was getting a little bit spaced out. I was like,
Right.
you know, I didn't want to.
So you took them for a few days and thought you're just not feeling well with them?
They just weren't. They weren't agreeing with me, but I am doing a lot more now.
So what have you done? What have you changed?
Well, I've got the haircut.
Yeah, that's good.
I
Make you feel
just
better.
thought I just like I'm helping my auntie a lot more because she's been ill, and so I've been helping her with the garden and stuff like that.
Yeah.
And trying to get like back up to looking for work and stuff and doing that now. So
Well, that's really positive, especially because you've done it without medication and you haven't.
I just thought after last time I was like, you know, having a little bit of a word with myself, thinking, yeah, I need to just snap out of it.
Are you having any of those negative thoughts about yourself?
No, I'm having bad days, but I'm not having like the thoughts that I was having before.
Yeah. What about those episodes where you're feeling like very aggressive and angry? Are you getting any of those?
I still have a few little issues with that. Like I'm a little bit like short-tempered a little bit.
Right.
And there's been some days where I haven't been arguing, and then some days I'm like, oh, goodness sake, like, you know, shut up, like. But.
And are you having any counselling at all?
No. I've been speaking a lot to my auntie. She's been helping me a few things in that, and then my family members have been helping me a little bit more with the talking situation. But no, I haven't really seen anybody else about it.
Did I talk to you about the counselling?
Yeah, you
so
did.
you've got the number.
I've still got the number, just in case. I'm still keeping it with my phone, and that's just in case.
Fine. Okay. Well, you seem to be much more positive, so that's good.
Yeah.
And you are doing it without the counselling or medication, so that again is
I
good.
feel a bit better than myself now. So.
Good. Well, that's all positive and reassuring.
Yeah.
If you notice things change, though, just either give me a ring or pop back in to see me.
Yeah, that's what I was going to suggest. Instead, like, you know, coming up here and like sort of, you know.
I'll see you in a few weeks.
Okay, thank you very much anyway for seeing
Take care.
me.
That's all right. It's a pleasure. Take care then.
Thank you very much.
Bye-bye. I'll see you in a month.
Thank you so much.
You take care.
All right.
Bye-bye.
See you later. Bye-bye.
Excellent. Thank you very much. No trouble. Lovely to see you. Bye-bye.